Navigating the complexities of sexual health can be challenging for adolescents, particularly when bombarded with conflicting information. Myths and misconceptions about sex are widespread, often leading to confusion and risky behaviors. It's crucial to debunk these myths with accurate information, empowering young individuals to make informed and safe decisions about their sexual health. This discussion aims to clarify common misunderstandings, providing clarity and guidance for those experiencing early sexual encounters. The belief that one cannot get pregnant the first time they have sex is dangerously misleading. The truth is, pregnancy can occur during any act of unprotected sex, regardless of whether it's the first time or not. Sperm has the potential to fertilize any egg at any encounter, making contraception essential every time. The misconception that sexually transmitted infections, STIs, are only a concern for those with multiple sexual partners is a common misunderstanding. The reality is that STIs can be transmitted during any sexual contact, regardless of the number of partners involved. This underscores the importance of protection, like condoms, during every sexual encounter. Contrary to popular belief, using 2 condoms does not provide double protection. In fact, it increases the risk of both tearing due to friction. The best practice is to use a single condom correctly to ensure maximum protection. Many believe that oral sex is entirely safe and free from the risk of STIs. This is a misconception. STIs can indeed be transmitted through oral sex, highlighting the need for protective measures like dental dams or condoms, even in such activities. Expecting to identify someone with an STI based on their appearance is unrealistic. Many STIs do not show visible symptoms, making it impossible to determine someone's STI status just by looking at them. Regular testing is the only way to be certain of STI status. There's a dangerous myth that if you're on birth control, you don't need to worry about STIs. Birth control methods, like the pill, may prevent pregnancy but do not protect against STIs. Using condoms is essential for STI protection. The idea that contraception is unnecessary during menstruation because one cannot get pregnant is a misconception. While less likely, it's still possible to conceive during this time. Therefore, contraception should be used consistently. Relying on the withdrawal method as an effective form of contraception is fraught with risk. This method is notably unreliable and offers no protection against STIs, emphasizing the need for more reliable contraceptive methods. The belief that washing or urinating after sex can prevent pregnancy and STIs is a myth. These actions do not prevent pregnancy or STIs. Once sperm enters the uterus or STIs are transmitted, these actions are ineffective. The misconception that sexual enjoyment is solely dependent on achieving orgasm undermines the varied experiences of sexual pleasure. Enjoyment can occur with or without orgasm and varies greatly among individuals. The misguided notion that sexual pleasure is primarily a concern for males neglects the importance of pleasure for all genders. Everyone, regardless of gender, has the right to experience and prioritize sexual pleasure. The idea that masturbation is harmful or abnormal is a persistent myth. Masturbation is a normal, healthy part of sexual development and exploration, and it carries no inherent health risks. Believing that STIs are not a concern in committed relationships overlooks the reality that anyone can contract STIs regardless of relationship status. Regular testing and honest communication are crucial components of sexual health in any relationship. Assuming that pregnancy and STIs can be entirely avoided through anal sex is incorrect. STIs can still be transmitted through this method of sexual activity, and while pregnancy risk is lower, it's not impossible. The belief that sex is supposed to be painful the first time is a harmful myth. While some discomfort is common, extreme pain is not normal and should be addressed with a healthcare provider. Proper foreplay, lubrication, and communication can help alleviate discomfort. Demystifying these common myths and misconceptions about sex is essential for adolescent sexual health education. Providing accurate information empowers young people to make informed choices, practice safe sex, and maintain healthy sexual relationships. As they navigate the complexities of their sexual experiences, it's important for adolescents to have access to reliable resources and feel comfortable seeking help when needed. By dispelling myths and fostering open, honest dialogue about sex, we can support adolescents in developing a healthy understanding and respect for their sexual well-being.